on behalf of the kidney doctor community, or also known as nephrologists, to welcome everyone here in this room. And first of all, congratulate the Kidney Warriors Foundation. We've put our hands together for a number of groups, but I would now request you specifically to really do that again for the Kidney Warriors Foundation, because they are the ones who have been the primary movers, and a number of people, starting with Vasundhara Raghavan, but many others who I would not name individually. They have been in touch with all of you on different occasions, and they have been interacting with everyone who has arrived a little bit ahead of schedule, and so you will get to see them also during the rest of the day. So please do take note of them and get their contact information. So I would say that's really very important, because more than anything, we are doing this as a kind of event. But for me, the most important outcome is going to be the networking that we will do. So let's keep that positive vibe in mind, and that vibe is shared by is shared really by all the members of the organizing committee, the scientific committee that put the program together. And I hope that the issues that have been presented in the program are the issues that resonate with you. It's important that the issues resonate with you, and that they are not put together only from the perspective of those who do the planning, because that is not then going to be a true success story of this meeting. So let's then get into the topic of this particular panel, which is to celebrate the history of nephrology in India. In terms, and I'll go in a minute to all the panelists who will share with us their experiences, their views, and path forward. So as we look backwards, we also continue to look forwards. So that's also going to be a little bit of a theme, and my request to the panelists that please keep that in mind as you talk about history. So the history of nephrology in India has been uphill for, I would say, for a long part of the last 60 to 65 years. It's been only in the last, in my assessment, 15 years or so, that the kidney disease community has achieved some recognition, and kidney disease itself has received priority. One of the biggest things that has happened, or rather two of the biggest things that have happened, one in India in 2016, when late Arun Jaitley, who unfortunately also had kidney disease, kidney failure, and has passed away since then, announced the national dialysis program in the union budget. That was something that really was a game changer, in my opinion. The second one, which is more at a global stage, has happened very recently, just last year, that kidney disease was finally recognized as a public health priority in the World Health Assembly at Geneva. That's such a big breakthrough. It's very difficult for people to appreciate, because once this statement is adopted by all the member states, then it becomes the responsibility of all the member states to go back and implement that, which in principle has been agreed upon. And then last year also in the United Nations General Assembly, kidney disease was included as a priority non-communicable disease. So a lot of momentum currently, and we have to build on the momentum. It's really great that we have the minister coming to inaugurate this, and we should bring it to the minister's notice that this is something which has happened, because often these topics don't filter up to the highest level, and they sort of remain buried in some files in the bureaucracy. The last bit I would say before I actually go to the panelists who are waiting very patiently is that while the kidney disease specialty has grown quite substantially in India, as is also evident by the formation of multiple societies, sub-societies, I would say. For the longest time, since 1970, we only had the Indian Society of Nephrology and its zonal chapters. But now we have societies that focus on various sub-disciplines of nephrology, which include various types of dialysis, interventions, nutrition, critical care, and what have you. And I'm sure that more will come along as well. But I would say again, this morning, the group that was we were missing for the longest time was the group of patients and public that wasn't involved that actively in how kidney care is delivered in India. So that's really a wonderful thing, and a matter of great celebration for all of us. So with that, let's just go to the panel, and I would start in the order of seniority, I would say. And uh, it's important for us to for those who don't know, to introduce all of the panelists in some detail. So, Professor Devinder Singh Rana is one of the first generations of nephrologists who trained formally in the specialty of nephrology. And I hope he will recount some of his experience as to what delivering nephrology care used to be like when he was a resident, getting up early in the morning, putting together dialyzers and what have you, and the expectations also that the patients used to have at that time. And in relation to that, since then, Professor Rana has been institution builder. He has set up the nephrology. So at that time, nephrology services were limited to a few centers in the country. And Dr. Rana is one of the first to set up a full-fledged nephrology program in Delhi. And the stable of Gangaram Hospital has since then produced a large number of nephrologists who have gone out and set up programs of their own. And currently, Dr. D.S. Rana is the chairman of the Gangaram Trust, besides being obviously an active practicing nephrologist as well. So thank you, Professor Rana, for coming and joining us this morning on a Sunday. Dr. Sundar is he lives up to his name, Sundar. He is also maybe not as senior as Professor Rana, but not too far behind, right, in terms of seniority, and being 1.5 generation perhaps in terms of setting up nephrology services, and one of the senior most nephrologists in Bangalore. He has been in a number of hospitals, and currently again practices actively, but perhaps not as actively as he was 20 years ago. And he indulges in a number of his passions and hobbies. Dr. Sundar is one of the first few to establish the discipline of peritoneal dialysis in the country. In addition to that, he remains very actively involved in society, societal activities, and he's one of the driving forces behind the activities of the Kidney Warrior Foundation also. And so therefore, thank you, Dr. Sundar, for being with us. And then if I might pass over Dr. Ashwini and go to Dr. Shyam Bansal first. Dr. Shyam Bansal is the head of Department of Nephrology at the Medanta Hospital in Delhi, and he is the current secretary of the Indian Society of Nephrology. He is also, again, in the capacity as the secretary, but also in his independent capacity, involved in a number of initiatives to promote the practice of nephrology, education of nephrology, and so on. In particular, he runs an annual kidney transplant update, which will happen again next week. But he's always interested in engaging with youngsters. He has put together a social media team in the Indian Society of Nephrology, and getting youngsters to be more and more involved in that advancement of nephrology. Engagement of a strong patient advocacy group in the Indian Society of Nephrology is perhaps the next step, Dr. Bansal, and we hope that we'll have the representation of patients and public in also the governance of the society, not only as a distant stakeholder. So thank you for that. Last but not the least, as I said, we talk about the past, but we also focus on the future. And Dr. Ashwini Gadde here represents the future. She is one of the current generations of nephrologists, and many of us who grew up in another time perhaps are less able to quickly adopt the developments that take place now currently, technological developments, non-technological developments, and many other type of sort of changes that we see. We have to continue to learn from our younger colleagues, And on this, I'm reminded of a line from the famous poet Robert Frost, who said, "As I grow older, my teachers get younger." So I think that's something which all of us should keep in mind and learn from them. And that's something which was inculcated, and I'm pretty sure Dr. Rana will second that. When we trained, both Dr. Rana and I trained as in the same institution at PJ Chandigarh. Uh, when we trained, it was really uh, re- repeated and drilled upon all of us to make sure that we represent the junior most member of the team equally. We respect and represent the junior most member of the team equally, and give them the opportunity to fearlessly say what they want to say. So and I think that is the spirit in which we should conduct the proceedings of the rest of the day as well. So maybe I start with you, Professor Rana. I'd like to firstly just reflect in general, whatever you think is from your vantage point, where the nephrology has come, how things were earlier. And I, I think this happens in these kind of meetings, is that uh, everyone is asked to name one single thing that they think as the single biggest advance that has happened in the last 50 years. And maybe as Dr. Rana makes his comments, you will also think about that. So over to you, Professor Rana.
Thank you, Vivek. And I must congratulate Mr. Raghavan for establishing this foundation and involving kidney patients. This foundation is going a long way as far as prevention of kidney disease is concerned, and as far as mutual help for patients required, whether they are in dialysis or no dialysis, transplant, or even CKD or NKD stage. I started my career in nephrology exactly 50 years back when I joined PJ Chandigarh in 1974 as a MD student. My first posting was with Professor KS2, who is known as father of nephrology in this country. And I was really impressed by his personality as a teacher, as a clinician. And eventually, after passing MD from that place, I took up the nephrology. But I remember my days in PJ Chandigarh. And seeing back now, I feel that the concept of nephrology was very young specialty, and training for DM nephrology or post-graduation in nephrology was existing in very few places. But if I see back then, even knowledge, the wake of clinical nephrology was very, very primitive. And as far as therapies are concerned, like dialysis and transplantation, this was also very primitive and a very initial phase. And there was totally learning phase of. If I go a little back to my undergraduate years from 1968 to 72 at Medical College Simla, then I can just tell you that once we saw some patient of kidney failure in the end stage kidney failure, then it was very tragic or very that at that time we never had any treatment. Professor will just pass on the bed, and every day sometimes you feel that he's still living, continue to give only 10%, 20%, that's close. And waiting for death in the hospital is a patient relative. Do not take the patient to home. That was the situation in 70s also in the country when dialysis and etc. they have started becoming available in the rest of the world actually. And dialysis was also very primitive as what Jha just told that at the time dialysis used to go for 12 hours. We used to make, some of you must be knowing what is dialysis, what is artificial kidney. Don't have photo here, but we used to make dialyzers ourselves. That I used to get up in the morning at 3 o'clock and prepare that because we had to attend class at 7 o'clock. So and make dialysis fluid. This is only for the people those who have undergone dialysis. That was sort of, and there was nothing available in the country as far as everything was imported, And this was the prerogative only few people. It is not a, I would say, if you put a 0 point something like that, there are people could afford in this country, and that also only people those who were lucky to go for transplantation, they will be only provided this opportunity at PJ Chandigarh or MD Delhi. I joined MD after passing MD from PJ Chandigarh. I became first postgraduate student in nephrology at all Institute of Medical Sciences, from where I graduated. I passed my nephrology in 1980 and joined the hospital, Rana Hospital in 1981 to establish nephrology, dialysis, and transplantation service in non-government sector. But I think that a lot have slowly, there are younger people, and what I've seen, I'm very much satisfied now that we have got a lot of training center in the country, and almost more than 300 postgraduate students of nephrologists are being produced every year. And in the years to come, they will be able to provide comprehensive care in all aspects of treatment. Whether, but as far as I'm concerned, I will just sum up that from the primitive knowledge of nephrology, in primitive state, dialysis and transplantation, we are fast moving now after 50 years or 60 years now in this country towards precision medicine, towards personalized medicine, and above all, to prevention. I strongly feel that in the last centuries, we made a lot of progress in understanding how the disease happens, why does it do happen, and learned all about the mechanism. But once the end stage organ fails, whether it's kidney, heart, lung, whatever, then the treatment is today also very dismal, very disappointing. The most important thing which I think that we have go to prevention. And once we know about the mechanism of disease or say pathophysiology of the diseases, it is very now easy to make policies for prevention, and all doctors, all patients, they should participate in prevention. That is the only way. As far as kidney disease is concerned, there are so many kidney diseases, but I think we are right now talking of CKD. Our aim should be that very few people should reach unfortunately CKD 5. And today we know that it is possible actually. And all of us, we can play an important, a vital role in providing this precision and personalized medicine treatment to the patient. That is what Vivek I would like to sum up. Thank you much.
Thank you very much. Thank you very much, Professor Rana. So, if I can, Professor Rana said, because the message is very important, 3 things I'll take out from everything. There's progress in therapeutics. We understand the disease better, and we now have a number of drugs which can slow down the progression of the disease. But I think the most important point that Professor Rana made is that we need to make sure that these preventive measures are actually reaching the people who can benefit the most from them. So that is the message perhaps we might want to impress upon the minister when she is with us. And one of the gaps here, although the government of India has announced the Ayushman Bharat scheme, that outpatient care is not covered by the Ayushman Bharat scheme. That's a big gap. And prevention happens at home, it doesn't happen in hospital. So if you get kidney failure, or if you get, and then your dialysis will be covered, but unfortunately prevention is not covered. So that's something which Professor Rana has brought up wonderfully well. So now passing on to you, Dr. Sundar, and I'd like to change the question a little bit. So now, and you and I, when we were growing up, the number of people who would come to a large hospital to get treatment for kidney failure was relatively small. because most people in rural areas and small towns, they just died at home, right, without having access to treatment. So, what do you think is the situation now? Are people able to access treatment more? What has changed, and what needs to change further in future? But other comments also that you might want to make.
Thank you, Vivek. Before I proceed, I would, as Rana ji said, we must congratulate Kidney Warriors Foundation for starting a patient group which was never there. And all the time, most of the time now I spend time building the trust, because trust is gone. Trust is the essence of cure. And all the time the media is saying doctors are doing this, doctors. The patient has lost trust in the doctor. Doctors have also lost trust in the patient, because now in the medical colleges, I was told, my son told me that we are told to consider every patient as a potential litigant. We have got Himali and Prashant there, lawyers sitting there. We are told that every patient is a potential. That's not a good way to go about, because we as doctors and patients, we are fighting the disease. We are not fighting against each other. This is a point which I should like to emphasize. And going back to my own training, I was trained in Christian Medical College, Vellore, and Rana ji said that he was trained by Dr. Chuk, father of nephrology. I consider Dr. P. Koshi, who is the father of even Chuk, because he started dialysis way back in 1962. So I'm proud of that. Now, coming back to your question, I'm getting old. You were asking me
Access to treatment, especially patients from small towns.
And before that, I think we missed out on introducing Dr. Vivekanand. He is probably the most famous international Indian nephrologist, I would say, in my opinion. In fact, I remember the first trip we went to Japan together. That was our foreign trip 35 years ago. So Dr. Joy is world famous, known all over the world. Wherever you go, if you say you are a nephrologist from India, they would ask, "Do you know Dr. Joy?" It was there like that. Now, access to treatment, what he said is very right. When I started nephrology in 1984, 85 in Bangalore, dialysis was affordable only to the mafia, the ambassador, and the gangsters. The common man couldn't afford dialysis. It was like that. And when I started dialysis, we didn't even have electrolytes. We didn't have flame photometer even to measure potassium. And the water quality was bad. In fact, dialysis was a torture, because acetate dialysis, no bicarb. All the patients would, in fact, be crying and they'll be shouting, "Ayo, ayo," they'll be shouting, because that is where dialysis was. So doing transplant was easy for them. So they would never ask it. Like now, when patient comes to us for transplant, they want guarantee. What is the guarantee? Those days they never asked, because they were already dead. My surgeon would say, "You're already a cadaver. I can't kill you again." So transplant was the only option. No, things have changed. I mean, technology has changed, information has changed, quality of dialysis has changed. Now we have Kamal Shah sitting, who is running the largest dialysis, and he's on dialysis for the last 30 years. You can't even make out. He looks like a handsome film actor on dialysis. 30 years. Kamal, get up. Everybody should see you. So that is the quality of dialysis has changed. And companies like Nephroclass or a lot of other companies, access to dialysis come in. But the quality is one thing which we have to look at. And as you rightly said, I think awareness has also increased now. Because I remember 84 when I joined, 82 when I joined CMC Vellore, people didn't know what was kidney failure. I would have scrotal swelling every OPD, hydrocephalus kidney swelling, because they thought only the men had kidney, Gurda, the scrotum, and come. But when MGR had kidney failure, the whole scenario changed. Because even the yellow journals had articles saying he had kidney failure, he is going for transplant. So the patient would just, I would have to tell them, "You've got MGR disease." The next question they would ask, "Do you think I should go for peritoneal dialysis? Can I go for transplant?" I think that's why I wish I'm not, we need more VIPs who have kidney failure and talk of kidney transplant. I think that is one thing. Definitely access to treatment has improved, because to me, coming from Karnataka, where everything was Bangalore centric, last year from Bangalore, we were sending our students to a small place called Gulbarga for training for doing AV fistula and interventional nephrology. That's a great change. That's what I look at the progress. Because, earlier, anybody was posted to Gulbarga, it was punishment posting. Any IAS, IPS officer, punishment, because Gulbarga was a dry place, nothing was. Now we are sending students for training to Gulbarga. I think that is one of the great advances in the society, I feel. Referral centers coming up and doing work.
Well, thank you, Dr. Sundar, for bringing up so many important points. And when we actually have time to sit back and reflect, then only we realize how much progress has been made. Especially this point about vascular access. Vascular access was such a bugbear even until about 15 years ago, and now you have many nephrologists, many centers doing excellent vascular access work, even in small centers, and vascular access care has improved tremendously. The point about dialysis and transplantation. So I will recount my experience. So when I finished my medical post graduation MD in medicine, and the time was at that time, you chose which subspecialty will you go to. One of the reasons nephrology attracted me was the ability that in medical science, if someone develops an end stage organ failure, at that time it was possible to treat an individual with only end stage kidney failure. If they had end stage liver failure, end stage heart failure, end stage brain failure, you couldn't do anything about it. But in people with end stage kidney failure, you could give them dialysis, you could give them transplantation. Admittedly, these were far from perfect, but there was possibility that you could do something about it. Cyclosporine had just come in 1989 when I started my DM in nephrology. So the possibilities were quite quite significant at that time. And have we lived up to all the possibilities? Perhaps not, but I think we have made tremendous progress, as you said, Dr. Sundar, and treatment has become accessible to much more accessible to the common man. Your point about the VIP involvement is so right, because I think even Mr. Jetli announced this because he had kidney disease. I think that was very
dialysis changed because
exactly that. And
VP Singh and
the role of VP Singh,
quality of water.
Yeah,
Dr. Kher told me changed because of VP Singh in India.
Correct. So Mr. VP Singh, the former prime minister, he was former prime minister at that time. He developed kidney failure, and I think these stories are important because they tell you exactly how change happens. So when he was on dialysis, he used to get dialysis in Delhi in good centers, right? And during dialysis, as Dr. Sundar said, he would get chills and he would not feel well at all. And then he was the former prime minister. He used to go overseas, and in London he would whenever he would get dialyzed in London, he would be fine, totally fine. And then he was an intelligent man, of course, and he investigated further and realized that water treatment wasn't done routinely in India at that time. And so then that's when he came back, and I think he spoke to Dr. Ashok Kripalani, and the Indian Society of Nephrology organized. I think Dr. Rana, you were probably the secretary
I
of
would
the
just
society.
like to mention here that today, if I think then, and that is word what I used when I joined Sir Ganga in 1981, and by that time, my only theoretical knowledge that both at PG Chandigarh, All Indian Institute of Medicine, all 3-4 more centers in the country, we were dialyzing patients with tap water. We dialyzed, actually Mr. Dev Jayaprakash Narayan at PG Chandigarh, when my colleague Dr. Vivekanand, myself, our teacher, Dr. Kushchug and Dr. Singh were very closely involved, and how we used to fill up the buckets and put the water, So it was that. And then when I appeared in the interview at Gangaram Hospital, then I told that I will never start dialysis in this hospital without treating water. We must have at least RO water. The criminal to do dialysis. And we were the first, I don't know rest of the country, but the dialysis was started at Gangaram with RO water only. And this facility was available. And today we have got a lot of RO available in the country, outside country. But that was the primitive stage when we started. But this was the only thing available. Of course, even BP Singh, when started at Polo Hospital, only he was getting dialysis through RO water, and there is separate room. So you can make, but the rest of the people were not getting. So that is the what. And I just want to specific question asked for my friend. That today dialysis has become very popular all over the world, all over the country, because of so many states are involved very closely, especially Andhra got involved that they provide dialysis to everybody. And now, of course, Pradhan Mantri dialysis Yojana, they are providing dialysis to almost everybody. And I want to tell you that I started hemodialysis unit in my remote village in Himachal Pradesh. I belong to Himachal Pradesh as early as 2009, when practically no dialysis facility existed in medical college also in Himachal Pradesh. And today we have got and started with the world class RO water, and today I have got 10 dialysis machine working that in the standalone dialysis when there was not even a hospital there. So things are improving.
Yeah. it's possible. We have less than 10 minutes now, and we have Dr. Bansal and Dr. Ashwini also. So, Dr. Bansal, you are the Secretary of the Indian Society of Nephrology. How do you think that the society has evolved over the last 70 years or 60 years of its existence? And what do you think that the society needs to do to become more patient-centered, involve patients more, and do a little bit more perhaps in research, such as registry and these kind of things?
Yeah. So first of all, I would like to thank New Warrior Foundation and congratulate Sundar ji for creating this platform for patient. And I think this is a one of the first kind of meeting where the doctors and patients they are sitting together and discussing all these important aspects. So we have two formal secretaries before Dr. Rana was Secretary Indian of Society Nephrology 25 years back, and Dr. Jha, and they initiated many changes at that time, and we are carrying it forward. So I would say in the last few years, what we have done. So one of the important work of the society is obviously to create awareness about the disease. Uh, See how the disease evolves, how we can prevent it, how we can treat it better, and how can disseminate the right information. So for that, we have created many channels, and if you will go to the Indian Society of Nephrology stall, which is here, we have our young team which are working, young nephrologists just passed out from AIMS, PGI, or many other institutes. So we have a team, and we have a team leader, Dr. Arvind Kanchi, who has been very instrumental. So we have, because now the social media is a very powerful tool. So we have our social media team, we have our Facebook page, we have our YouTube channel, we have our Instagram page, we have our Twitter handle. So all these are there. So and there we are creating videos for the education of the patient. And I would invite everyone to be subscribed to those channels, get the right information, because nowadays we are seeing there is a lot of misinformation in social media, and a lot of people get swayed away, because then whenever there is a easy way, people tend to go towards that, and which is often the wrong way, because there is no scientific basis for that. And I'm sure all of the nephrologists among us, and I personally, we see so many people who are coming with the complication which can be actually prevented, which can be patient can be taken care of much better way without much complication. And once you know, because still the reality is that 80% of the treatment nowadays is provided in the private hospitals. The government 80%, whether it is a dialysis facility, whether it is a transplant, whether it is a other care of the patient, that is being done in the private hospital, and it costs a lot. And when a patient lands up in a complication, then obviously there are more expenses and more this thing. So what I think, the Indian society is working on this, and it's very important, because something which comes out from doctors, because as Dr. Sundar mentioned, there's a lack of trust nowadays, which is more and more. And there's something, this patient coming to me, I'm explaining to something that you need this treatment or dialysis or transplant, and there's a bit of so this comes from the patients there from out, then some more sort of reliable than coming from the doctor's perspective. So the society is doing many things, and I hope, unless the patients are associated with it, we will keep on providing the information. We are trying to get, actually, Dr. Jha mentioned about the advocacy group. So we have created an advocacy group, and we are planning to meet the maybe we can have discuss with the minister to declare NCD, because kidney disease is still not part of the NCD in India. And then if we can, because that is a education is very important. Unless there is a right sort of information and education, people will not get the right treatment and right direction. So we will welcome any sort of suggestions or from the patients group. And I invite all of you to visit these stalls of Indian Society of Nephrology. We have prepared some handouts and many information channels for the patients.
Yeah, thank you. As you said correctly, that and Dr. Sundar said one of the ways that we can build trust more is to get patients into the governance of the society and have them give the message of the society rather than them coming from the doctors themselves. So I think that will be accepted more by the patient community. So quickly, Dr. Ashwini, uh, now what do you think as someone who's more contemporary compared to some of us? What do you think can we expect or the patients expect in the next 5 to 10 years so far as Indian nephrology and patient care is concerned? And what would you think that the different stakeholders need to do to get us to that particular point?
Predominantly, as last few years, many things have changed, especially the safety in the treatment has changed a lot in terms of dialysis and transplantation. In terms of normal medical management, also the treatment has become more evidence based rather than just following the norms. So basically, we are focusing more on the primary goal of medical management is we will do no harms. So we will not write any treatment without any evidence. We will write the treatment which is only proven. There are many patients here who are more learned in nephrology than me, possibly by their experience. There are many young patients now also which are possibly getting more learned because of the availability of information on social media. So now it's our duty also to accept all those change in patients' behavior. We can't get insulted by the idea that they are asking me questions. I have to respect that question and get out to the option and answer to that. So that change is necessary in us. Second important thing is, as sir said, there are many lots of information on the social media. There are alternative medications which are there on social media. But every time you do that, I think you should get back to your nephrologist, consult them whether this is a evidence based. Then only we should carry forward the medical treatments henceforth. Otherwise, these changes in the behavioral patterns of the patient, we need to adopt to it, is what I feel.
Thanks, Ashwini. So you are absolutely right there that so far as we expect change in the behavior pattern of patients, we should also encourage our colleagues, doctor colleagues, to also change their behavior patterns. And there are a number of things which we can go into, which perhaps prevent or slow down the way we could perhaps provide better care to our patient partners, and make sure that we provide them with the care, as you said correctly, evidence-based care, and not care which is often given without any evidence, right? I mean, there are often we see long prescriptions which have molecules for which there is really very low evidence or no evidence at all altogether, and people don't realize. The other thing we might want to also be mindful of is that often it's important that we be empathetic to the in the way we talk to our patients, because giving difficult information is not easy. We are everyone has busy clinic and OPD, but when the patients come to us, they come with some expectations, and it's important that they go back with their questions at least answered. I have suggested to some of my colleagues that their clinics, at least someone sitting outside, once they have finished their consultation and gone out, they should fill in at least one answer to one question where all your questions answered. If not, then they should perhaps come back. So that's one way in which we can provide more empathetic care to our patients. The other thing we could do better is to even audit our own practices. From time to time, we don't do that. How have we done in terms of some benchmarks that we can set for ourselves, or the society can set, so that it becomes a general benchmark against which we measure ourselves. It is not an examination. It's not something that needs to be reported to someone else, but it helps us ourselves sort of reflect back on how we all have done. And in some ways also gathering some metric of patient satisfaction. So those are a few things that we can do. I think we have to learn from history. The history tells us that we need to make sure our treatment is more and more patient-centric rather than being paternalistic as we all used to be in the past. So less that. I think the time is up, but last minute comments from any of the members.
Before, very rightly said, I became a better doctor when I became a patient myself. When I had my heart attack under ICU, see, common things like, patients complain to us after transplant of constipation, a few things which we ignore. We say we have saved your life. But to me, after the angioplasty, I told my cardiologist, I don't mind dying, but please solve my constipation first. These are things, unless you've gone through it yourself, you don't understand. So that is one aspect. I think you become a better, I'm not saying we should all become patient, but you become a better doctor once you become a patient.
No, if you wait long enough, you will become a patient. we all know that, right? Professor Rana, any comment from you? Any last minute?
I will stress that let us all work towards prevention, and let us all work together with the government to make, unfortunately, if the people reaching stage 5, be on dialysis or transplantation, then make it affordable and accessible. And let us create awareness about cadaver transplant, which are not taken in this country except in few cities. And that's all. But anyway, let us be optimistic. We are progressing well. We are not going retro. It's a forward movement only, though we're going steadily. With all respect, we are making progress.
Ashwini?
I also feel that government is as in taking attention in terms of funding for dialysis and peritoneal dialysis, but it may, I am not saying that should not be done, but this is not a very cost-effective way. Prevention should be the key where we should focus more in terms of funding and strategy planning. Second thing is also important aspect is the family and the caregivers also, which are basically they play an important role in both the families. They are the bridge in our communication also. So I feel more support groups like this also. This is many of my patients are also unaware of the support group. So I think the more dissemination of information should happen so that they can join the other patients. That also will create sort of spreading away the actual good, reliable information rather than just taking it from the media.
Shyam?
Yeah, so actually, when you encounter patient with kidney disease, some of them, many of them, in fact, are very afraid of the disease itself, its progression, its outcome. I would just make a point: the overall care of the kidney patients has improved a lot over last 2 or 3 decades. If you see the dialysis, like we have an example there, but there are many patients who are doing well on dialysis for more than 10 years or 15 years. There are many patients who are doing better on transplant for many years. So kidney failure is, and as the science evolves and the new evidences come, so this may even further improve. So obviously we all agree that prevention is the most important thing, and the right information. These two things are very important. But once you develop the disease, and then there are, if you get the right treatment, you go the scientific way, and this should come from, as I say again, from the patient to circulate the right information among their groups and societies and other places, so that patients get the right treatment, they don't get into the complication, and outcome in most of the patients, they do well with even after kidney failure.
Yep.
If they get the right treatment.
All right, thank you. Thanks, everyone. On the panel, you have made excellent point. The diversity of views is important. As we conclude, I would just like to sum up with 2 points. This panel was about the history of nephrology. We all who know the pioneers in the kidney disease field, starting from Dr. Koshi, Dr. Raghavan in Bombay, Dr. Chug, Dr. Mani, Dr. Amiresan, Dr. K.V. Johnny, many others, the extraordinary hardships that they have faced during that time should not be forgotten by us. And the world has moved on, and we have gotten used to a life of comfort, and we want things to come easily. But it is our responsibility to respect the legacy of those pioneers and do whatever we can to make life better for our patients, because that is what they did in their time. And the second thing, I would request all of you patient partners, you are partners in this journey, right? So please help us. Help us by being frank and fearless in how you feel, what do you want us to do, give your opinion. I would slightly differ from Dr. Bansal is that it is not your primary responsibility to dispel the myths. It is our responsibility in working with you. I don't think that it's fair for us to put the entire onus on the patient community, but we give them the information. We make sure that we are working with the patient community. And the point about caregivers made by Ashwini is an excellent one, because more than the patient, the caregivers also get burnt out, and we need to consider their point of view as well. Indeed. And Marianne is sitting on my back because she wants us to get off the stage. So thank you, everyone, and thank you for your patient listening.
Ladies and gentlemen, a big applause for our first panel, and thank you very much, Dr. Jha, for heading the panel. A big thank you to our panelists for beautifully taking us back to where the journey started, recalling names who set the stage and to where we are.